I have a small bone to pick with people using the Band-Aid analogy, or something just being a Band-Aid treatment or therapy, because a Band-Aid for a cut on your skin is actually precisely what the wound needs as a treatment strategy to help heal, to help reverse the cut. Band-Aids keep wounds free from debris. They help keep it more moist compared to letting it dry out with the surrounding air. A mitigation strategy would be cutting your skin and having pain and taking a pain pill. The pain pill in that case is not actually helping you to reverse the disorder, but the Band-Aid is. So a Band-Aid can be an effective treatment, and so I think people are using that analogy kind of wrong when they invoke it all the time. I know what they mean, I just don't think it's quite clear. I agree with the theory, the idea that we don't want to just mitigate or minimize or reverse symptoms. We want to actually reverse the disorder, which should correlate to, of course, symptoms being abolished. For musculoskeletal problems, that means restoring full pain-free range of motion in all planes of the joints, full muscle strength, full nerve extensibility, and of course that correlates to functional ability being normalized. I strongly argue that the reason so many musculoskeletal problems recur, especially in the neck, mid-back, and low back, is because people feel better and they don't restore all of their normal musculoskeletal features like the range of motion, strength, and nerve extensibility, and therefore there's predisposition to the problem recurring because the problem was never actually reversed. And part and parcel of understanding how to reverse the disorder is patient education and the patient understanding what actually happened and how to kind of keep these things at bay in the future, or make sure that when they do recur, the recurrence is more mild and self-treatable without having to go to a medical provider again. But I see this all the time. We need to actually reverse the disorder. Now, many people are just happy to get back to life if 80% of the pain is gone or even 50% of the pain is gone. And I try to argue that I think they'll have a better long-term result if we actually get the joints or muscle or ligament or whatever it is fully healed. Another example would be, say you fracture your tibia. After a few days of rest, it feels fine. And you wouldn't go running on it because someone has probably educated you that we need to use an x-ray to see how that bone has healed after 6 to 8 weeks and make sure it's good to start loading it. Just because you feel better doesn't mean that that bone fracture has fully healed. The same applies to other less obvious things in the orthopedic system. So yes, we want things that reverse disorders. That, of course, is dependent on clinicians being able to identify root causes of disorders. If you go to a clinician and you complain of hamstring tightness, and we find that your abductors and the hip on that side are weak and your hip flexors are a little bit weak, and you address those by strengthening your hip flexors and abductors and massaging and stretching your hamstring, and you feel great, well, what was the actual diagnosis? I don't think, in my book, hamstring tightness and hip musculature weakness is not a diagnosis. There's probably something causing both of those, and you're treating them like they're the actual disorder when the weakness and or tightness are actually symptoms of a higher disorder. Maybe something's not moving well in the hip joint. Maybe something's not moving well in the lumbar spine or even the sacroiliac joint. But if you have a clinician who can identify the root cause, that helps you find all the little bits and pieces that are part of that clinical picture and make sure that all of those things are reversed. Because if this hypothetical patient leaves the office after a few visits, feels really good, but the lumbar spine was actually the root cause and they're still missing 50% of lumbar extension and 25% of lumbar side glide to the affected side, then we know that the disorder is actually still there. It's just not presenting with those symptoms anymore. Those symptoms were treated, but we need to argue, was the disorder actually reversed? So think about that Band-Aid analogy when you hear it. What people mean, I gather, is that we want to do things that reverse the disorder. We want to fix the diabetes. We don't want to just give you pain pills or insulin or, mitigate the problems in your diabetic foot or your kidneys or your eyes. We want to actually reverse the diabetes. And the same thing applies to musculoskeletal problems. We want to fix the disorder, which is depends on being able to name the disorder, name the root cause, name the associated signs and symptoms, and figure out how to fix the root cause so that all of those signs and symptoms go away. We don't want to just mask symptoms with pain pills, for example, or with injections, for example, or with even soft tissue work, for example. We want to actually get the system moving, functioning back normally again, and therefore, if you do that, the symptoms should go away.